50-year-old Cindy Wekamani gets her chronic medication monthly. However, the nearest health facility is 20 kilometres away from her house, meaning she has to wake up as early as 4 a.m. to beat the long queues at the clinic. She also has a knee problem, and every step she takes is exhausting and painful. Rainy days like today mean a week delay in getting her medication, as they are only handed out on specific days.
I have sleepless nights before I have to go get my medication. I can't sleep at night. I toss and turn because I'm thinking about the long road I have to travel to go and get my meds. On top of that, my knee hurts so much and I have to keep taking breaks. When I eventually get to the clinic, I still have to wait close to 7 hours in the queue before I'm attended to. I fully support the plan to make schools vaccinating sites. At least then it will be a closer walking distance for me and perhaps shorter queues.
This is the plight of most residents in some informal settlements and rural parts of the Eastern Cape. Out of the country's 24,494 communities, over 6,000 will have to travel 5 kilometres to get a vaccine at a healthcare facility. Out of these, 45% is in the Eastern Cape. The plan is to use more than 2,800 schools as vaccination centres in the province. Provincial Health is waiting on the National Health Department to guide them on the safety requirements for the vaccination rollout.
At engaging Department of Education, and already we have presented, to then see what we can do to make a school to be a suitable vaccination site. We need to observe issues of infection control. We have to also look at the layout for the processing of the vaccination process to ensure that there is space for vaccination that is secure, that is also amenable to being antiseptic, and also space for waiting to ensure that when people are vaccinated, they can wait so that we can observe for adverse events. What must be understood is that we're not going to store vaccines at a school, because the school is not a building for that purpose.
The province says a collaborative effort by the Provincial Government of Health will ensure that the rollout of the vaccine is a success.
We're going to be working with a lot of partners, because e-vaccination is actually much easier than treating patients, because e-vaccination is that you've got one useful, effective intervention, which is the vaccine. That needs a simple system to actually administer. In this case, you need a vaccine, you need an injection, and it's actually not invasive in the body because it just goes onto your muscles. That can be done by very well-trained lower levels health professionals under the guidance and supervision of hired people. So we anticipate that the task shifting and really moving and using some of the people that we have, we're also going to be able. What's going to be important in the vaccination program is that it has to be devolved and be used from the bottom up. And we need to be looking from where people live and actually make sure bring the vaccines to where.
However, unions have given conditional approval for the use of schools to administer COVID-19 vaccinations in the province.
We wish to cite that all precautionary measures, therefore, rather make a plea that all precautionary measures that would ensure that the schools which will be used as these vaccine centers at least should be kept safe, healthy, or be left in the manner in which they were found, so that no one again will be vulnerable to the virus on the basis of the school having been utilized as a center for the vaccine.
The Eastern Cape Department of Health says it plans to vaccinate 3.7 million people within 6 to 9 months. This means that each health worker would have to vaccinate 50 people per day to reach the said target. A hefty task, but they say it is possible with the use of schools and recreational centres as vaccine sites. Lerato Fekisi, SABC News, Port Elizabeth.